My name is Prashant Urs. My son was born here in Apollo Hospital. The pediatric doctor was Prashant Urs. And when my son was 8 months old, he suffered from brain hemorrhage.
I'm Dr. Prashant Urs. I'm senior pediatrician and neonatologist at Apollo Hospital, Bannerghatta Road, and also Apollo Hospital, Sheshadripuram. Today, I'm talking about an interesting case we came across at Apollo Hospital, Bannerghatta Road. It was a child of around 1 year old who came with convulsions. Or what we call as seizures, in other words. And this is a common thing to happen in children between 6 months to 6 years to get these febrile seizures. And generally, the treatment is also simple. In this particular case, when the child came for febrile seizures, as we do as per the protocol, the child was admitted for observation and the fever was treated. And after the treatment of fever, we also noticed that the convulsion which the child had got, even though it is common among children, in this particular child, we found that there was a little difference, which we call it as atypical febrile seizures, because it was involving only one side of the limb of the child. Based on this, we thought he needs further evaluation, and we got a CT scan done by Dr. Savith, our interventional neurologist.
I am Dr. Savith Kumar, interventional neuroradiologist working in Apollo Hospital, Bannerghatta Road. This child presented to us with fits. This was due to a bleeding in his right side of the brain. This bleeding happened because of an arteriovenous malformation which the child had. So the arteriovenous malformations are abnormal communications which develop between the arteries and the veins in the brain. These can present from headache to bleed to heart failures. So these need to be treated.
We came to the emergency with the help of the doctors here. They have taken care of everything. And later on we came to know that in his brain he has AV fistula. That is the medical term. Due to that, there was a internal bleeding. So that was treated at that point of time, but then in order to prevent it in future, Dr. Savith and Dr. Arun has suggested to do the angiogram. Through that, they will basically block that portion so that it doesn't happen again. It was just before the COVID, so when the COVID started, then we are also scared it should not harm our child. So we took our time to come to a conclusion that okay, we need to do this. After 2 years, we did the MRI again, and the reports are kind of negative, and again doctor suggested that we need to do the angiogram and block that portion into the brain so that it doesn't happen again.
To our surprise, we found that he had a huge AV fistula which required treatment. And because of his age and his weight, we deferred the treatment immediately, and it was later done by Savith. And what is important is this child did not require any surgery, which we used to do earlier, but with the advancement which is available in our hospital, such a complicated problem in the brain of such a small child was handled very delicately by just a coil closure, which was done by Dr. Savith without opening the skull, which would have been the case otherwise if we did not have this advanced treatment.
Endovascularly, through a small pinhole in the groin, this child was treated completely without any scar or prolonged hospital stay. The advanced technology available in a hospital and the expertise, we were able to treat this complex condition without any surgery or a scar and without a prolonged hospital stay, and giving a complete cure to the child.
This was a very interesting case and an eye-opener for us to investigate in any child who comes with atypical febrile seizures. Thank you.
The kid is doing really good. He's going to school and everything. He's doing all the activities that he was doing before. So that way, we as a parent, we are really happy and thankful to Apollo Hospital, to Dr. Arun, Dr. Savith, and Dr. Prashant.